thank you for joining us for Nutrition and Diabetes, a virtual community program presented by Nani Lepicard. She is a registered dietitian at Valley Hospital. Nani has been an RD for 23 years, and she has been with Valley for over 5 years. Nani is also a certified diabetic care and educational specialist, so you are in great hands with her tonight. So this presentation will conclude with a moderated question and answer period. You can submit your question throughout the presentation by clicking Ask a Question. It usually appears in the upper top right-hand corner of your screen, and we will we'll work with those questions towards the end of the presentation. So please join me in welcoming Nani. Thank you, Nani.
Thank you, Joe. Welcome everyone on this nutrition program, Healthy Eating for Diabetes. So the objectives of this program are to learn which foods have carbohydrates, to learn how to calculate carbs per serving using the nutrition facts label, and to learn about meal planning to optimize glycemic control. In review of macronutrients, so we have carbohydrates, which is a main source of fuel at 4 calories per gram, easily used for energy, breaks down into glucose. Carbohydrates are important for brain function and brain fuel, and also they're a good source of fiber. Protein is needed for growth, tissue repair, and immune function, preserves lean muscle mass. It's required for production of hormones and enzymes, and can be converted to energy through gluconeogenesis. Fats are needed for normal growth and development, provide energy at 9 calories per gram, and are essential for absorption of fat-soluble vitamins. Healthy fats such as avocados, walnuts, fish with the SMASH acronym, salmon, mackerel, anchovies, sardines, and herring, along with eggs, should be included in a healthy eating meal plan. In reviewing the pathophysiology of diabetes, we have type 1 diabetes, which is essentially an absence of insulin. This can be caused by inherited or genetic factors, environmental, such as a virus or a chemical, or a self-allergy or autoimmunity, such as multiple sclerosis, lupus, Crohn's, or celiac disease. The presence of antibodies such as GAD, insulin antibody, islet cell antibody, zinc transporter antibodies, 2 or more of these abnormal antibodies combined with abnormal glucose levels are generally confirmatory of type 1 diabetes. Type 2 diabetes is essentially insulin resistance, where the body is producing insulin, but the cells are not responsive to it. Increased risk factors for type 2 diabetes are sedentary lifestyle, a BMI of greater than 25, a history of cardiovascular disease, a first-degree relative with diabetes, or a high-risk ethnic group. The recommendation from the American Diabetes Association is for all adults over the age of 35 to be screened annually. Diagnosis of diabetes. As we see from this chart, diabetes on the far right, an elevated fasting blood sugar of 126 milligrams per deciliter or above, a 2-hour post-oral glucose tolerance test of 200 milligrams per deciliter or above, or a hemoglobin A1C of 6.5 or above. Now, any one of these indicators is confirmed by repeat testing for the diagnosis of diabetes. Now we talk about blood sugar response. So here in this graph, the blue line represents a person without diabetes, and a red line represents a person with diabetes. So as you can see in this graph, this is assuming post-meal, the red line indicates a spike after a meal, a higher spike, and a slow normalization to normal blood glucose levels as compared to the blue line. So with this graph, it is important to know to consume meals in combination to better manage these spikes. Consuming a meal such as, for example, cornflakes for breakfast or a refined white bagel can result in a higher spike and a slower to return to normal blood glucose levels. Blood sugar targets are generally fasting or before meals 80 to 130 milligrams per deciliter, 2 hours after a meal less than 180 milligrams per deciliter, which is 2 hours after the first bite, a hemoglobin A1C goal of less than 7%. Now, your numbers perhaps may be different depending on what your doctor has indicated for you. For those people that are at higher risk of hypoglycemia, we do relax those numbers, and we say that the higher the risk of hypoglycemia, the higher the goal for the A1C. So how do we achieve our blood sugar targets? So now we can monitor blood sugar via a glucometer and a finger prick. Another key method to monitor blood glucose are the use of continuous glucose monitors such as a Freestyle Libre or Dexcom, which are inserted into the arm via a filament into the tissue or the interstitial space. So now let's talk about the foods that contain carbohydrates. So we know that starches, breads, grains, and cereals contain carbs at about 15 grams per serving, which is essentially 1 slice of bread, a half cup of a starch, a potato or pasta, etc. Fruit at 1 small piece is about 15 grams. Milk we see is 12 grams. Cheese is included. That can be a lower amount of carbs depending on the type. Vegetables that are non-starchy are at 5 grams per serving, and that is a half cup cooked or 1 cup of raw vegetables. Meat and fat do not contain any carbohydrates. Here are some common serving sizes of various items. We have a slice of bread, a quarter of a large bagel, a 1/3 cup of cooked rice, pasta, a half cup of cooked cereal such as oatmeal, 3/4 cup of ready-to-eat cereal, and so on. We have our fruit, generally the size of your fist or a small piece, an apple, a pear, etc. We have 17 small grapes or the size of a cup. And then for dairy, we have 1 cup of milk or 6 ounces of yogurt. Other serving sizes: 2 inches of a square of unfrosted cake, 2 small cookies, a half cup of ice cream or frozen yogurt, etc. Now we're going to see, what does that look like? So we see this is a very small bagel, which is the size of a baseball, a small fresh fruit the size of a tennis ball, a baked potato more or less the size of a mouse, a half cup of beans, peas, corn, or potato size of a baseball, and a 1/3 cup of pasta or rice the size of a muffin liner. And we have 1/2 cup of chopped or cooked fruit size of a baseball. More serving sizes. What else has carbohydrates? So again, we know that non-starchy vegetables such as broccoli, tomatoes, cucumber, lettuce, salad, etc. These contain 5 grams of carb per serving, and again, that is 1 cup raw or 1/2 cup cooked vegetables. versus starchy vegetables such as peas, corn, or sweet potato at 1/2 cup serving for about 15 grams of carb each. So now we're going to look at the nutrition facts label. So we see some of the important areas to focus on: the serving size. We also have the total carb, and also it's important to note, obviously, the calories. So we can look at this particular item. We see that it's 2/3 of a cup, which is more or less about a 1/2 cup serving. We see the calories are pretty high, and the total carbs at 37 is also high. So this would probably not be a healthy item to have, but could certainly fit in a healthy eating meal plan. So of note, the Food and Drug Administration has proposed new food label guidelines, which would include front of label placement for nutrition facts, and also indicators such as low, medium, or high for nutrients such as saturated fat, sodium, and added sugars, which are the 3 nutrients linked with chronic disease. More information to come with that. Here's another serving size, another nutrition facts label. We have 1% milk. We see the serving size of 1 cup, the calories, and the total carbs listed at 13 grams. So we know that this is a healthy item, fits into a healthy eating meal plan. So now we talk about fiber. So fiber is the indigestible part of carbohydrates, the insoluble fiber. It is not absorbed and it does not elevate blood glucose levels. Of note, the average person consumes about 17 grams of fiber a day, whereas the goal is 28 grams per day or 14 grams per 1,000 calories. There is a calculation that you can do for those that want to know about advanced diabetes. When there are 5 grams or more of fiber per serving, you can subtract half of the fiber from the total carbs. So example, total carbs are 30 grams. We take half the fiber at 7. 30 minus 7 is 23. That is your net carb. So this is more for those people that are taking pre-meal insulin dosing and don't want to overdose with their insulin, causing a hypoglycemic response. So for the rest of us, we know that fiber is good, fiber is filling, and also of note, fiber can also modestly lower A1C levels by 0.2 to 0.3% with 50 grams or more of fiber per day. And also to keep in mind, if you are increasing your fiber, that you also want to increase your fluids via water. Calculating macronutrients. So this is done based on individual needs, height, weight, BMI, exercise status, activity level, etc. This is a quick calculation as a guide to see about how much carbs, protein, and fat you could determine. Carbohydrates, we look at 45 to 50% on average. That's a little bit on the high end if you are a person with diabetes. Protein at 0.8 grams per weight, fat 20 to 35%. So we're going to look at the carbohydrates, for example, based on a 2,000 calorie diet. At 50% is 1,000 calories divided by 4 calories per gram, 250 grams per day, or 80 grams of carb per meal, which is about 5 servings of carb per meal, which is, again, on the high end. So we would aim for maybe 40 to 45% to meet that better ratio of carbs to protein to fat. And then you see the calculations for protein and fat. So meal planning recommendation is about 3 meals per day with a snack, preferably at bedtime. And these meals look like 45 to 60 grams per day, which is about 3 to 4 servings of carb at each meal. 1 snack per day again, preferably at bedtime, looks like 4 crackers and an ounce of cheese. The reasoning for 3 meals is to enhance the effectiveness of medications and for those medications to act on a spike of blood sugar from meal times. And if people are grazing and eating, multiple times throughout the day, it does make it difficult to achieve those pre-meal and fasting goals of 80 to 130 that we referenced earlier. Here we have the My Plate method. Been around for some time. There's also the diabetes plate method, which essentially is half of your plate is going to be vegetables and the other half is divided by your carbs and your lean protein. So here we have some sample meals. We'll start with a sample breakfast. 1.5 cups of Cheerios, preferably a multi-grain, about 30 grams of carb, a 1/2 cup of sliced strawberries, 8 ounces of 1% milk, 1 egg, and a tablespoon of chopped walnuts for a healthy fat is about 49 grams of carb, which fits into the recommendation of 45 to 60 grams per meal. And here we have a sample lunch. 2 slices of whole grain bread, about 1 cup of small grapes, 1 cup of raw cherry tomatoes, a 1/2 cup of romaine lettuce, 3 ounces of chicken breast, 1/3 of a medium avocado for a healthy fat. Total carbs is 55 grams. Sample dinner. Total carbs here is 50 grams. Healthy snacks, a small apple or pear, about 15 grams of carb, plus almonds or 1 ounce of cheese, 1/3 cup of hummus with vegetables, cucumber, red bell pepper, broccoli, etc., or 3/4 cup of a fresh pineapple with a 1/2 cup of cottage cheese. More healthy snacks. So now we're going to talk about type 2 diabetes medication. So most of us have heard of Ozempic and Trulicity and Victoza and Mounjaro, Zepbound. Seems as if everyone is on them. These class of medications mimic a naturally occurring hormone that is present in healthy persons without diabetes. These group of medications mimic a hormone called the incretin hormones. And in persons with type 2 diabetes, these natural hormones are significantly diminished. How these medications work is they promote fullness, satiety, slow down digestion, and also work to enhance insulin secretion. These medications are generally taken once weekly, injectable. And also of note, these medications are also very important for their cardio and renal protective benefits. So we talk about metformin. Metformin is often considered the go-to medication for prediabetes or type 2 diabetes initially. How metformin works is it inhibits the synthesis of blood glucose in the liver, and it also helps to make a person more sensitive to insulin. The SGLT2s class, common brand names for Farxiga or Jardiance. This group of medication works by eliminating excess blood glucose in the urine, essentially acting like a diuretic, and inhibiting the kidneys from reabsorbing blood glucose, and instead eliminating them in the urine. DPP4s, such as Januvia or Tradjenta, this class of medication, oral medications, works by enhancing insulin secretion based on blood glucose levels or load. The next group, the meglitinides, which is known as insulin in a pill, stimulates a rapid burst of insulin. We also have TZDs, or thiazolidinediones. These work by increasing the body sensitivity to insulin. Sulfonylureas, such as glimepiride, glipizide, and glyburide, work by secreting more insulin, and often a side effect is hypoglycemia. And of course, we have insulin, short and long acting, various kinds. We have our short acting Humalog, Novolog, Fiasp, etc., long acting Tresiba, Lantus, Levemir, etc. So now we talk about the glycemic index. So according to the American Diabetes Association, the glycemic does not have a significant impact on A1C values. But for those of you that are interested, this can be incorporated into healthy eating meal plan. So how this works is essentially the GI, or the glycemic index, is the rise of blood glucose after eating 50 grams of a specific food within 2 hours. The GI number is a percentage or rise compared to pure glucose, 100% of glucose in the bloodstream within 2 hours. So we have some common foods and their glycemic index, such as whole wheat bread at 80, soda at 72, brown rice at 50, pizza at 33, chocolate bar at 49, etc. So sometimes the problem with the glycemic index rating is that often foods that are favorably low glycemic can also be unhealthy, such as a pizza, or we have here chocolate. And conversely, foods that are high in the glycemic index, or maybe not so favorable, would be foods that are healthy for you, such as whole wheat bread. So we know that whole wheat bread turns to sugar, but also whole wheat bread has fiber, which is necessary for GI health and function. And it's also, again, source of fiber to help lower cholesterol and manage blood sugar levels. So again, taking this with a grain of salt and just using this to enhance a healthy eating meal plan. So now we talk about sugar alcohols, which are about 2 calories per gram. These are often your sugar substitutes, used as sweeteners or thickeners. Some sugar alcohols are also naturally occurring in fruits and vegetables, such as apples, pears, pineapples, sweet potatoes, and carrots. These sugar alcohols provide less calories than table sugar. And if a food contains more than 5 grams of sugar alcohols, half the grams can be subtracted from the total carb. However, these sugar alcohols can cause GI disturbances, adverse GI symptoms, and has a laxative effect. So bearing in mind to consume these foods, not as frequently. And some of the sugar alcohol names, when you're looking at the nutrition facts label and looking at the ingredients, erythritol, glycerol, hydrogenated hydrolysates, isomalts, lactitol, maltitol, mannitol, sorbitol, etc. Some of these sugar alcohols can have adverse effects, and some of you may have heard that erythritol has been in the news recently for causing adverse health effects, especially cardiac events, stroke, or heart attack. So the key is not to overconsume foods that are made with these sugar alcohols. It can fit into a healthy eating meal plan, but to not have them as your mainstay or go-to beverage or food or snack. Also, wanted to mention that these sugar alcohols, when you do have a snack that does contain them, and you see on the nutrition facts label here, we have total carbs of 14. So oftentimes sugar-free is not, as we know, not carb-free. So certainly we need to read the label and to, if you're not sure, to look at the ingredient list to verify that it is either carb-free or sugar-free. So now we get to helpful websites and apps. Calorie King is a popular app. Fujicate, Lose It, MyFitnessPal is another good one. Anything from the American Diabetes Association, they have plenty of information and guides. EatRight.org, that's from the Academy of Nutrition and Dietetics. And we also have myplate.gov is another great source of information from the FDA. And it's important to know that when you are getting information from the internet or social media or what have you, that you are using something that is backed with reference from the science or a medical academy, because as we know, there's a lot of misinformation out on the internet, and before we're following any kind of trendy or perhaps unsafe diets, we want to make sure that the source is verified and that it is safe. So our take-home messages for this program are that eating foods in combination can make a major difference in blood glucose control and having a carb and a protein and a healthy fat together. You don't need special foods. The foods that are good for you are good for everyone, such as the Mediterranean diet. Eat a variety of foods that contain the right amount of nutrients. Eat for good health, not just for your blood glucose value. And more importantly, a good diet does not replace exercise. So I want to thank everyone and for attending this program. And now we'll get to the questions.
Well, thank you, Nani. That was a great presentation. We do have one question that someone asked. We're also on a little bit of a delay, so we'll hope that you guys have some additional questions. But someone asked, how can you be hypoglycemic and then be classified with prediabetes?
That's a good question. Someone is hypoglycemic and yet they have prediabetes. So we know from looking, let's go back to our diabetes diagnosis parameters. Let's see. Okay. So if someone is pre-diabetic, we consider that a hemoglobin A1C of 5.7 to 6.4. If perhaps the person is checking their blood sugars only at one time, doesn't show an entire picture, we encourage people to check their blood sugars, 2 hours after a meal, after the first bite, before bedtime. Check your blood sugars at varying times to get a different picture. But sure, it could happen that you're low blood sugar, but it's, again, if you are diagnosed with the prediabetes by 2 repeat testing of any abnormal parameters.
Thank you, Nani. So while we wait and see if we get any additional questions in, I just wanted to take the time to say, if anyone is interested in meeting with a dietitian, Valley does offer outpatient nutrition counseling. You can always reach out to us. You can call us at 201-634-5371, and we are always available. Most insurances do provide coverage for that. And, you know, if you're having problems or struggling with anything, we can help walk you through that. That's what we're here for. So let's see, any additional questions coming through? I think we got a quiet group tonight, Nani. All right, we'll give it another minute for our delay.
I guess that means I covered everything.
Well, that's exactly what I was going to say. That means it was an excellent presentation because she answered everyone's questions. All right. So if anyone does have any additional questions, please feel free. You can email us with the link, the email address that was sent out to you guys. Let's see. Here. Okay, everyone's waking up now here. Great job. How much exercise should we get in?
That's a great question. So the recommendation is to have 150 minutes of moderate intensity activity. Can you hear me?
Yep, you're good, Nani.
Okay. So the recommendation is to have 150 minutes of moderate intensity activity weekly, or, you know, whatever is safely tolerated. Obviously, people have different activity levels, you know, just start with something. You can break down 30 minutes of activity 5 days a week into 2 15-minute increments, you know, go take your dog out for a walk around the corner. We have nice weather now. So really, you know, no excuse to not get out there and get some at least low level activity, walking, etc.
Great question and good answer, especially with this nice weather coming up, right?
Definitely.
Let's see. Do the websites you suggested give sample meal plans?
That's a good question. They may. I haven't delved into them particularly to retrieve a meal plan, but they could. There's, you know, information on American Diabetes, and of course with eatright.org. They might just give a simple overview of, you know, a basic meal plan, not anything like, you know, extensive for a week meal planning or anything like that. So,
Let's see. I'm not sure, but let's see. What happens if someone has a diabetic attack? What to do? I'm assuming Nani may be low hypoglycemia, low blood sugar, but
Sure. So exactly that. We don't know what it is. Is it hypo? Is it hyper? So in order to determine how to treat, we need to check that number. So either if a person is wearing a sensor or you know, needing to access a glucometer and finger prick and check the blood sugar level to determine treatment. And we know if the blood sugar is less than 70, for most folks with diabetes, that we would give a treatment, generally 4 ounces of juice, wait 15 minutes, recheck. If it is hyperglycemic, then in that case, I would call your doctor to see what needs to be done.
great answer. This one is, does Medicare cover nutrition counseling for a pre-diabetic person? I'll take this one, Nani, if you don't mind.
Please.
Unfortunately, Medicare will not cover if it's pre-diabetes. Medicare will cover if it's type 1, type 2, chronic kidney disease, or if you had a kidney transplant within 36 months. But sometimes if you have a secondary insurance, they may be willing to cover that. What should you do if you have pre-diabetes for many years?
Another good question, if you have prediabetes for many years, now certainly you want to continue with that follow-up with the primary care provider or endocrinologist, whoever's monitoring your levels, to make sure that it's not increasing into the type 2 range, which is, at 6.5. If you have prediabetes and you're not making any changes, that can certainly go into, established type 2. But if you do have prediabetes, again, lifestyle interventions, healthy eating, getting that activity, that can definitely make, significant impact in your level.
Great answer. I'm not seeing any additional questions, but all the information, the questions were great. All the information that Nani provided was awesome. Again, we're here for you guys. If you want to meet with a dietitian, give us a call. We'll be more than happy to help you guys. And let's see. So I just want to say thank you, Nani. Thank you to all the attendees for joining us. If you do have additional questions, please, you can email them to us using the link that was provided. You can also give us a call on 201-634-5371. We'll be more than happy to direct those questions. One more question popped up, Nani, if you don't mind. Let's see. Are there any variations in diets based on meds you are taking, Ozempic, metformin, etc., or are diets independent of meds?
So when we talk about diabetes management in general, regardless of medications, we're talking about general healthy eating. So again, we can't stress enough, think about the Mediterranean diet. I mean, that is not, bad for anybody, unless you have other comorbid conditions. Keeping it simple. If you are taking a medication like Ozempic or Mounjaro, you want to not have foods that are high in fiber, especially high in fiber or high in fat, that could complicate the slowing up digestion or causing that fullness or, nausea and things like that. So for some of those medications, you can just be, mindful of fat content.
All right. Well, we'll try it once again. Thank you guys for joining us. Reach out if you have any additional questions. The Valley Dining Nutrition staff is here for you guys. If you need an assistant, have questions, that's what we're here for. So thank you, everyone. Have a wonderful night. Thank you, Nani.
Thank you.